Now, hi, everybody. This is a supplemental recording that I'm going to be doing, and it will take the place of uh, what did not come through as a recording from last term, dated 1/27/22. And so you'll see on the blackboard the list of recordings, and so this is just an additional one to follow the one that you saw from 125, and it'll be a continuation of that. And so I will point you to that right now. Let's make sure I have everything here, and we'll be able to do that. Wherever that PowerPoint is that I was just trying to do. Here we are. Here it is here. So you'll see it here, and you have this PowerPoint, but it's easier if I, without having to look at all of these, if we're able to do it this way. There you go. So this is where we left it off. This is radiation effect on oral tissue. And again, and I know I stated it before, and without re-listening to all of these, there's a wonderful series that I can send you if you have HBO Max, that you must watch, called Chernobyl. It's not the documentary; it's a dramatization that had 5 episodes, brilliantly done from 3 years ago. And there's a section, and I will make an effort to find it as I scroll through it, where they describe what happens in the people who suffer this intense radiation problems at the Chernobyl disaster back in 1986. Fascinating. It's one of the best things I've ever seen on HBO Max, and that's saying something with all the shows that I've watched since the inception of HBO back in the late 70s. So I mean, I remember looking for that. This was, historically speaking, when cable TV, and now obviously everything is streamed for most of us, but back in the day when they first initiated cable TV, because most people had antennas, historically, in the early 70s, we began to see the onset of cable TVs with people with poor reception, and it became subscription TV. And the earliest ones were HBO and something called teleprompter, which I think eventually became Showtime. So, obviously, without getting into the business ramifications of all this, I mean, there was a gal that I went out with for quite a while who got her first job in New York City as a communications major out of Syracuse, which is a fascinating communication school, to uh, got a job in the early days with teleprompter. I don't know if she stayed with that or not. The last time I heard about her was from a buddy of mine who also dated her. She's from Chicago. But long story short, I'll see if I can get you the information. It really is very, very interesting without going to a dissertation about cable television. So, I'm sure I commented on this and I didn't listen to it, but this is what we begin to see. Think of the areas where the cells are rapidly reproducing and where the damage manifests itself early. So, what do we see? Redness and inflammation. Eventually, these interesting things called pseudomembranes, because what happens is the tissue undergoes a phenomenon of death called necrosis. And it goes from being white, and then it begins to yellow, and then the tissue is dying. Okay, and we're talking about it from a effect of radiation therapy, but in the context of that HBO show, it was radiation poison. And what happens now, the dryness, and one of the things we do see, and I happen to suffer from an immunosuppressant drug periodically. That I take the immunosuppressant drug all the time, and what happens is something called Candida albicans. That's a yeast infection for those, and I think all of you had micro. I know that some of you had micro with me. That this is something that you begin to see. You begin to see a lot of discoloration and flaking of the lining of the tongue. And so that's a yeast infection. Now, normally it doesn't take 2 months to heal, but in effects of radiation, that's different. There's a throat, it's not really a throat lozenge, it's a tongue lozenge. Something dissolves on your tongue topically that's utilized to treat that. So as we continue on, and I have to, you're going to be periodically, you're going to see some slides that are really commercials in the middle of this because you have to pay for this. Okay, if you don't, the taste buds very, very sensitive. So, and we've seen this with COVID, the fact that certain inflammatory processes alter taste and smell. This is part of it as well, even though this certainly has nothing to do with COVID. But what happens is it's the same kind of idea, is that the cells become damaged. loss of taste during radiotherapy. Here it happens early onset with COVID. Okay. And again, we know where these are. So you have the tongue is really divided into the anterior and posterior portion. So posterior, bitter and acid, while the anterior, sweet and salt. We get most of our flavor from the anterior part of the tongue because sweet and salt is something we pick up right away. Okay. And as you can see, it takes a long time to recover. A lot of the dryness and what precipitates these problems are the lack of salivary glands. They're extraordinarily radiosensitive. And the parotids, which are the largest glands, produce the bulk of the fluid. They can become inflamed and they can fibrose and they can deteriorate. And they play such a pivotal role. And this is when you get into the dental effects. Saliva plays a tremendously important role with maintaining overall dental health. And so when you lose drying up of salivary glands is an intense problem for a lot of people with chemotherapy, certainly with radiation therapy, with gastrointestinal effects. It's really a sick because the saliva has a lot of immunological products. The saliva has a lot of antibacterial products that are there, effectively defensive materials, as well as keeping things wet, moist, soft, lubricated. And so you can see it doesn't take a lot of radiation without getting into the specifics of grays and SVs. Dryness of the mouth, again, you'll get some residual salivary gland compensation. That's nice. Missing the O there. Xerostomia or xerostomia, pardon my pronunciation, is something that, and I've seen cases of this with dry mouth and patients that I've had. So here we're going to skip to the next slide and skip to the next slide. So here's the problem with the teeth, particularly developmentally. So and look, childhood cancers and childhood need for radiation treatment does not have a good prognosis. Let's be clear. If this is an area where you might be doing treatment or interventions, understand that to be as supportive as you can, because to me, the prognosis is poor. These children die sooner than later, unfortunately. So during their development, and when we talk about developmental stages, it's before the secondary teeth come in, preceding, if it's very early, preceding calcification or in utero. So after calcification inhibits cellular differentiation, malformations, general growth. So children receiving radiation therapy shows defects in permanent dentition, such as retarded root development or missing one or two. And so, and again, these are the types of things you're going to have to be presented with. So here, dental decay, salivary glands playing a role, caries, which means cavities, reduced saliva, decreased acidity, which retards cavity formation, reduced buffering, which was able to maintain the pH where it's supposed to be. The viscosity is the nature of the sort of that sort of mucousy or slightly oily consistency that saliva has. So 3 types of radiation cavities. One, widespread, superficial, which means on the surface, different teeth are involved, circumferentially cervical involvement, dark pigmentation of the entire crown. So they're pretty good. And for those who've had me before, I don't do teeth. I'm not a big teeth person from that standpoint. And now as we continue on, these are some of the ways that you can deal with it. There's a sodium fluoride gel. Fluoridation and fluoride have been very useful for caries, such as fluoridated water. The main player, lactobacillus, which alters the pH, and streptococcus mutans, which is the principal infecting agent for dental, and of course hygiene. And these days there are a lot of restorative processes. A note: with dental restoration is not cheap. Most time it's not covered by your dental insurance unless there's unusual circumstances. So it's out of pocket. Very, very expensive. And we get to bone. And with bone, as a hard tissue that's well calcified, you would think it'd be insulated, but not necessarily so, because it has to do with the fine blood vessels. And particularly, we see them more in the mandible. The marrow, as you can see, loses some of its cellularity, and hypovascular means loss of vascularity. So you get fatty material that goes in there. or fibrous material. And so this leads on to non-healing wounds at extraction sites and sores. And again, this is so-called osteoradionecrosis. So that's a real problem. It has to do with the vasculature inside the bone, and it's not just limited to the mandibular area. So here you can see lots of things. We recommend do extraction and alveolectomies 2 to 3 weeks before radiation. Time for healing. And you see there's and certain things you have to do after radiation and different things, and they apply as well from trauma of prosthetic appliance. That means so artificial teeth or implantation, hyperbaric oxygen utilization, etc. They're parts of it. This is what you see, the acute radiation syndrome. This is what was manifested so brilliantly in that dramatization, which again is one of my favorite shows. And I always, before I do this course, I watch it again. So, so a collection of signs and symptoms as a result of radiotherapy, atom bomb blasts, or in the case of Chernobyl, and what we see more today, radiation-related accidents. And this is not please don't mistake. This is not me telling you that nuclear energy is something terrible and oh my God, we shouldn't have anything to use with it. If it can be done safely, it's a very effective way that, interestingly enough, if you can deal with a waste product, is environmentally friendly. The key is how are you if you're able to find a way to store waste products and limit them in such a way. So there's a whole lot to it, but I think that if we're so concerned about environmental things that we have to find other ways, alternate energy alternatives. I don't see anything wrong with utilize myself personally. I think we have to be watchful because there's all saying there's in science we don't see a reaction without an equal and opposite reaction. It's just the rules of nature. If we impact one area, we're going to have alterations in another area. So you have to be. It's the complexities of the planet, okay, that are part of it. But without me being preachy about it, this is the acute radiation syndrome. So hold 1 second while I answer a text, and I'll continue. So it's a collection rather than something individual, and it starts with a prodrome. Unless you're directly burned, then you're going to die if you come in contact with significant nuclear waste directly. You're going to see those changes on your hands immediately. It's going to be just like a tragic burn that just the recovery will be comparative. There would be really no effective chance of recovery, and the person's demise would be relatively quick onset. But typically, prodrome, and then particularly, even if it appears that they're getting better, we begin to see bone marrow destruction, and then your body's defenses go away. The linings, and particularly in the gastrointestinal area and other areas, and then eventually heart and central nervous system problems proceed. The embryonic cell. So in this particular dramatization, where they focus on a lady who's pregnant, as whose husband dies in the Chernobyl disaster, she's pregnant at the time, and although she doesn't die, effectively her baby absorbs all the radiation and is effectively stillborn or dies shortly after birth, though she is able to survive, interestingly enough. Okay. Not without incident, but she's able to survive and actually live a relatively long life. And so the tragedy here is this baby, the last remnant of her husband, who's not going to survive very long. Embryonic cells are highly radiosensitive, and that has to go back to this idea of undifferentiation. They rapidly undergo mitosis. They are very nonspecific. So there's the cell. The more advanced a cell is, or what we call differentiated, the less likely it is to respond or be affected adversely by radiation. Okay. So as you can see, during periods of implantation, right after conception at 10 to 14 days, we'll see malformations. You can see the chart that's presented here, which describes it. Organogenesis, which occurs roughly within that, as you can see, we're in that like 6 to 7 week period is the most sensitive. Retardation, microcephaly, mental retardation. So carcinogenesis. Most cancers, if there's a survival 10 years after exposure, childhood risk exposure twice as large as adulthood. So no, and so when they talk about the mortality rate shows no linearity below those units that are used to measure radiation. It's not linear, so it doesn't necessarily increase. Linearity would mean it would increase as the dose increases, the mortality rate increases. So it's a little bit. I don't know how well it's been studied. Cancer due to radiation is multiple of spontaneous rate. Leukemia is certainly a major player because of the bone marrow. 5 to 30 years. So people who have been exposed early on, eventually the bone marrow damage. And as you can see, this has to do with bone development as well, because usually by age 20, bones have been completely developed. So perhaps there's a greater degree of insulation of the bone marrow. Again, we covered the dental stuff, dental radiographic x-rays for your teeth, a small risk. And there's various things. Collimators, and I'm sure you're familiar with these from the textile, is something that we learned about early on when I first learning about not just taking x-rays. It's so important to collimate, to be able to be very, very specific to sort of, we call it coning down, the image to exactly what you want. So as you can see with dental, the highest estimated risk from leukemia, thyroid, and bone surface cancers, the panoramic x-rays there, so the Panorax carries 1/10 the risk of a full mouth radiography. So it's a little bit different. I had one of those done recently, as I recall. Growth and development. Children exposed to, and this is again nuclear disaster, reduced height, weight, skeletal development, mental retardation, 4% chance of mental retardation per 100 of units at 8 to 15 weeks of gestation, cataracts, which are an ongoing problem with radiation exposure, and in various thresholds. The genetic aspects of it. It's when they talk about radiation inducing new genetic mutations rather than spontaneous mutations, they're looking at Drosophila, that's for fruit flies. No threshold dose, so it's almost any damage can be impacted. In humans, the genetic doubling dose for mutations resulting in death is approximately one of these units that are there. So I think you have to look at the amount of dosage and to understand that these are accelerating. And when they talk about radiation genetic damage may induce new genetic mutations rather than spontaneous mutations. So, I mean, we're looking at its mutagenic effects are certainly well known and understood. And here, just a little bit more about the genetic implications. I don't want to talk to you so much about, just to understand that they are certainly significant. That when there's a large amount of exposure, we're always going to have problems. And the necessary, as I'm sure you're well schooled in, for shielding appropriately in the gonadal area is understood. And that's everything. So I just wanted to complete this unit. I did record it before, and there isn't a great deal to it, but I did want to make sure that I gave it to you in the context that's here. And what I am doing is I'm looking through a lot of these presentations to make sure that they are complete and that everything is covered so you can adequately prepare for the examinations that we're doing. Thank you.